Hi, my name is Dr. Mark Blatt. I'm Intel's Worldwide Medical Director. I'm here today at the HIT Exchange Summit in Palm Springs. Just got on stage and we had a great discussion about the ROI of an EMR. And one of the things we actually concluded was the EMR going forward is a foundational platform that will help contribute to the virtualization of healthcare service delivery. By that I mean non-face-to-face care using the information contained in the EMR to help care for patients. We also concluded that the EMR technology as it exists today, while a necessary infrastructure, is not a sufficient infrastructure to help virtualize care. That integrated clinical decision support tools, integrated video conferencing, and the ability to view images and telemetry along with other relevant patient-side data is going to be critical to this. But the EMR is a good start in this direction. I'm not sure in the next 6 to 12 months we see any great change, mostly because of the meaningful use payments. They've kind of, if you will, trapped and defined what's going to go on in that industry. We've seen the stock market respond wonderfully to the publicly traded EMR companies, sometimes with a doubling or more in value. They're back-ordered. They're working hard to fulfill the requirements around MU2 and MU3 to come. I think that defines the market in the short term, simply getting those certifications and requirements out. Longer term, I think it leads into an evolutionary trend towards collaboration platforms with integrated analytics like we talked about. I think the payer and the providers ultimately need to figure out how better to work together. They're not two sides of the same equation. It's not I'm going to keep cutting your fees and you figure out how to be more efficient and do more with less. I need to rationalize how I pay you. I mean, if I design a system where I pay you for volume, I'm going to get volume. There's just no doubt about it. So I need to actually be able to trust you and not transfer, let's just say, all the risk onto you, but share risk with you, give you the data that I uniquely have as a payer that I've accumulated in a longitudinal history, turn that into knowledge and a knowledge infrastructure that I can help support patients with. I have a bigger longitudinal view over longer periods of time, often than individual providers do. I may be able to act as the hub for an exchange going forward, or at least contribute to the exchange. So I think collaboration between these two entities, as opposed to the somewhat adversarial relationship that they've had going up to now, is what's going to be called for.